Social marketing is applying communications to making life better for individuals and for communities. It really is the application of marketing to advancing ideas and practices and behaviors that promote healthy people, healthy communities, and social good. Well, we have lots of issues. They range from personal health issues, for example, the early diagnosis and treatment of disease or the prevention of disease, to community issues, for example, traffic and transportation safety or emergency preparedness, to social issues. For example, right now we're working to help combat youth violence in the United States and also to foster positive relationships between teens, dating relationships between teens. All of those types of issues require encouragement and support and information that prompt and support people to make desirable change. Without question, advertising, although I will observe that over the 25 years that I've been doing this, advertising has ceased being the defining feature of these campaigns. Rather, it's a supporting element of these campaigns. And that's prompted by a number of factors, including the fact that government agencies are not as able as they have been in the past to put large, vast amounts of money into the campaigns to support paid advertising. But going beyond advertising, that's very good at generating awareness. We do tremendous earned media, going out and enlisting the support of traditional media and increasingly social media to be interested in our issue and to carry it forward in ways that are appropriate to them and to their readers or viewers or participants. We do an awful lot of community organization, literally going out into the communities where individuals live and reaching them through schools, workplaces, community groups, civic organizations, literally bringing a wide variety of influencers into the story that we have to tell, into the behavior that we're seeking to change, and helping to foster their sense of responsibility for joining with us to achieve the objectives being pursued. One of the pitfalls is clearly being sort of moralistic and taking a moral stance and appearing, as we've been discussing a great deal, to be the voice and the arm of the nanny state. People are not quick to want to listen up to a command and control message from government, or for that matter from any authoritative group. Command and control is I think a thing of the past. So that clearly is one pitfall. I think another pitfall that we have found is that we tend to impose our vision and our values on the population at large. It's a mistake. You cannot assume that people necessarily approach an issue or approach a concern with the same judgment and with the same perspective that we do. So I'm constantly reminding my colleagues of the huge importance attached to understanding our audience and understanding where they stand on an issue, and not to assume that where we stand is necessarily where they're going to be. Observation, focus groups, the pure social marketing, and certainly government-sponsored social marketing always requires substantial formative research. And our government clients require us to do the research that justifies, defends, and explains any direction that we might take. And if it's not centered in fact that's derived from focus groups, or perspective that's derived from research, it's likely to be rejected. Evaluation is almost always a absolute requirement of our publicly funded programs because of the fact that government agencies hold public accountability. We always are expected to measure outcomes, to measure the products of our work. So, for example, the volume of earned attention, the volume of paid media that's generated, the quality and quantity of partners and their engagement in the issue, and how effectively we've mobilized communities. We also ultimately need to show that as a result of these efforts, something is happening differently, that there is an uptick in the number of people seeking a screening, for example, or an uptick in the number of people who are calling a hotline, or contacting a clearinghouse to get information, or indicating their intention to take action or talk to a doctor. Those tend to be routine requirements that we have to track and to measure and report. One that I'm enormously proud of is the Heart Truth campaign, sometimes known as the Red Dress campaign. It's a campaign in the United States for the National Heart, Lung, and Blood Institute. Over the past 7 years, this campaign literally has reframed the agenda of women and heart disease in America. It has prompted women to wake up and recognize that heart disease is their #1 killer, despite the fact that more than 4 times as many women die of heart disease as cancer and breast cancer. They don't recognize that. They don't realize the relevance. In fact, they see heart disease as being a man's disease. And through this campaign, and through an innovative set of partnerships, including a partnership with the fashion industry, as well as with many corporations, as well as not-for-profit organizations, we literally have gone out across America, raised awareness of women and heart disease, raised awareness of the symptoms and the need for prevention and treatment of heart disease. Our efforts have influenced how physicians practice and engage in supporting women patients. Historically, they have tended to be aggressive treating their male patients, not so aggressive treating their female patients. I do think that scenario is changing. And as a result of these efforts, the partnerships, community organizations, the earned media, a limited amount of advertising by the campaign, but a larger amount of advertising by our partners, we literally have decreased the rate of death of heart disease in America. Recent surveys suggest that whereas before the campaign, 1 in 4 women died of heart disease, current statistics suggest that as a result of the campaign and all of the activities that it's been a catalyst for, 1 in 3 women now are dying of heart disease, a tremendous public health success. Who knows? I'll be honest with you. I wondered myself how many years we could keep the same level of attention to the issue and the use of some similar techniques. But the fact is, this year, this would have been the 7th year in which we launched this year's campaign at Fashion Week. This year we generated more earned media than ever before. So what we do is try each year to introduce something new, something novel that keeps the core identity in place, but which adds some new features, including the effective use of celebrities to keep the issue alive in front of the public.